make the argument that this can help identify possible disc pathology. Whenever you're creating an anterior shearing force or any type of shearing force, you're going to deflect the annular fibers in the nucleus as well. The idea here is, in the standard position, I don't do this standing, I do it sideline. I'll show you sideline in a second, but I'm going to have you place both hands over your stomach here. This is what's pictured in the Olson book. The therapist's front hand is going to be over the patient's hand, and that's going to be applying the posterior force. You'll find the S1 spinous process. Place your fingers on the sacroiliac joint, and just below that spinous process, apply a posterior shearing force to assess for the amount of movement that may be happening there. And then you're going to move up the segments. And once again, you're applying a posterior shear of the superior segment over the anterior segment, creating an anterior shear of the lower segment on the upper segment. So to me, this is just creating a shearing force. That's why I said that, you know, sometimes these posterior shearing tests are positive in patients with clinical lumbar instability. You'll do that movement all the way up the spine. The way I like to do it is I'm going to have you just lay on your side facing the chalkboard, so everyone's in the back.
Were you pushing with your front hand or back hand? Sorry.
The pressure's on my front hand.
Okay.
And what I'm doing with my finger is assessing how much it moves over, and really the pain is the big thing.
Okay.
In the side, the problem with the standing up position is you're engaging all of your trunk muscles. So to me, how passive of a movement is that there? In sideline, at least the person can relax their body. Scoot a little bit closer toward me. To do the posterior shear test in sideline, what I'll have them do is the spine has to be straight to begin with. I'll bring the knees up, the hips up about 90 degrees. Okay? And now what I'll do with my hands, I'll find that S5, that L5 segment, stabilize, and now the posterior shear is through my legs. I'm creating the force, pushing him backwards here, through my hip. And then I can go up one level at a time. The thing I really look for on this test is the onset of the pain. And again, a lot of times when I'm doing this test, I'm thinking if it's positive, a lot of times more disc pathology type symptoms. Come up to the next one and just apply that posterior shear force. Okay? That's how I do it. And I can assess for the amount of movement there and just work my way up the spine. Or I can start at the top and work my way down, whichever your preference is. That's the way I do this test, typically in the clinic. Yeah. It's pretty easy. Is that any pain right there?
Why is it disc and not just instability? Or can it be both?
It's both.
Oh, okay.
It's both.
Okay.
It's also your facet joints. And a lot of it depends on what the pain is, but the pain's broad across both sides of the back. I feel like you're also sharing the discs there, and they could have some discal involvement.